Welcome to our coverage in New York. I'm Connell McShade on News Nation Now, and we begin with Dr. Leigh Vinocur, who joins us, board-certified emergency physician, chief medical officer, with reaction to what we just heard from the Pentagon. So let's talk now about the medical diagnosis as it is. You know, prostate cancer is a very common diagnosis, particularly for men in the United States. But then there were complications after that sent the secretary back to the hospital. What would you say about what we just heard on Secretary Austin?
Well, I think, any surgical procedure has a risk of complications from infection, right? That's always an issue with surgery. Prostate cancer, depending on your age and how aggressive the tumor looks when they take biopsies, it can be caught early with blood tests like PSA and regular exams with your doctor. So if you catch it early, it does have a good prognosis, a little bit like breast cancer in women. But the procedure and the surgery is a lot more complicated than breast cancer in women because it's deep in the pelvis. There's a lot of robotic surgery, and there is always that risk for surgery for infection. And I think from what we've been hearing, he was put in the ICU with an abundance of caution from the infection, and they were draining the fluids, but that he's doing much better and is out of the ICU. So a lot of times,
something, as you understand, that might be fairly common, this buildup of abdominal fluid after a procedure like that. They said, just reading from the statement, that it impaired the function of his small intestine, so they used a tube, placed it through his nose, and drained the stomach. That's something you're saying that, that happens obviously from time to time when you have prostatectomy.
Right. Well, any intra-abdominal surgery can have a fluid buildup with it.
Yeah.
You don't want to leave it too long, and you worry about if that fluid gets infected. And any extra pressure or tension inside the abdominal cavity can kind of squeeze off the small bowel so that things are not running through your GI tract. And the reason they put a tube in your nose is to try and relieve the pressure off your bowels so you don't eat anything. It sucks the air out that, we swallow air all the time when we're talking, and it moves through our intestinal tract. So this kind of is something called bowel rest, when you put in an NG neurogastric tube down and you suck out all air and fluids that your GI tract makes, and you let the bowel rest while you drain fluid intra-abdominally that probably collected.
Right. And they said that's been taken care of now, and he's being treated in the hospital. As you said, he's out of the ICU, and it appears, from what we know now, from what we've told now, the worst is certainly behind him, or the challenges that he was facing are behind him, and he's in recovery. On the 22nd of December, we were told that the secretary was going into or had gone, and we weren't told about this until about 2 days ago, but we were told that on the 22nd of December, he had what was described as elective medical procedure, an elective medical procedure. I'm not going to ask any political questions on, on timing or what should have been disclosed, but, just as a physician, this is not an elective medical procedure, is it, or is it?
No, it is. I mean, it's not considered emergency surgery. Things like a bowel rupture is emergency surgery. Cancer surgery, of course, the person that has cancer wants it out, wants it treated, but it's not really considered.
But it technically would actually be elective then, the way it's described in the medical community. Okay, yeah. So that was a fair description in that way. Maybe not whether it's misleading or not is another question, but the idea of whether you're medically correct in saying so. You think it's all right. Final thing here, prognosis for someone 70 years of age, Lloyd Austin, the defense secretary, 70 years of age, after having this procedure, the complications that we know so far, you would say?
Well, it's hard to tell because there's a lot of factors. There's something called a Gleason score, which looks at the actual tumor cells, how aggressive they are. If it's extended beyond the prostate, it sounds like from everything they're saying, it did not. And just like catching breast cancer early for women, catching prostate cancer very early for men has a high cure success rate. So, but he's going to have to be watched and checked frequently following PSAs and things like that, which is the blood test. So.
All right. Well, thanks for hopping on with us so quickly and giving some context on this. It's important for our viewers. We appreciate it. Dr. Leigh Vinocur with us, and we want